maybe they were having anemia, but he wrote massive GI bleeding. And nearly all were elderly people, and he says, well, about 60 to 80, and they clinically had aortic stenosis when he was auscultating them. And he looked at the literature and didn't find any association, and he was asking for help. This is the publication: Aortic Stenosis and Massive GI Bleeding. Here we can see an aortic stenosis as described first by Menkeberg in 1904 here in Germany. But as I mentioned to you before, in Heyde's there was no mention at all about angio-dysplasia of the colon or arteriovenous malformations. Here we see some angio-dysplasias that we have found in patients who have Heyde syndrome. This is not the colon, this is the small bowel, capsule endoscopy. And you can see here the malformation, the deformed vessels, the neoformation, the neoangiogenesis. These are some lesions in the colon. And here you see another type of diffuse neovascularization, some larger vessels and some finer vessels. Some authors down the line started to investigate, and this is from the Mayo Clinic. They investigated 91 patients who had aortic stenosis and recurrent unexplained GI bleeding, up to 20 bleeding episodes and 900 units of blood transfused. And what the authors found was that patients who underwent aortic valve replacement and did not die during surgery, 2 died, but of the 14 who survived, there was no further bleeding in those who had successful surgery with survival. So this was sending a clue that something was going on at the aortic valve. And at one point, some authors started to make a connection between vascular ectasias, angio-dysplasias, and aortic stenosis. Greenstein had seen 11 patients with colon angio-dysplasias, and he says, well, let's see what they have, and they have aortic stenosis. Oh, so they looked at all the patients admitted to Mount Sinai over 10 years, 3,600 patients, and half of them had mitral stenosis, and half of them aortic stenosis.